I am Denise Elliot. I am in private practice here at West Jefferson Medical Center. We see any kind of foot problem that walks in the door, which can involve the skin, the bones, sprains and strains. We work 5 days a week and do surgery 2 days. A bunion is a bump that develops on the base of the great toe. It usually is caused by genetics. Most people inherit their bunion. Usually the bone structure of a person is passed on generation to generation. A bunion can become very painful as the bone enlarges and the deformity increases, which usually occurs with aging. As this happens, especially for women, if they're wearing a tighter shoe or a heeled shoe, this will compress on the prominent bump and cause skin irritation, calluses. Since most of the pressure goes through the bunion, this can also start causing joint pain, difficulty with walking, some throbbing, joint pain. When a person starts having pain and symptoms with the bunion, we would first start with conservative treatments. Usually we'll have them add what we call a bunion pad, which is more of a cushion, not medicated, just something to protect them from pressure, usually from shoes. We'll try to get them to start wearing maybe an open-toe shoe, a wider shoe, something without a heel on it, limiting the heel height to under 2 inches. If the joint pain becomes severe, we might prescribe an anti-inflammatory or other medication just to help control the pain. Once conservative treatments are no longer helping alleviate the pain, we often have to consider surgery in order to actually correct the bunion and the bone contracture. So surgery can involve something as simple as shaving off the prominent bump, which is done in the operating room, or sometimes the bone will need to be cut, shifted over into correct alignment to alleviate the pain. Recovery will depend on the surgery that was performed. A simple shaving of the bump can be done usually under local anesthesia. It has to be done in an operating room setting, and weight bearing is allowed immediately post-op. Now when the bone has to be cut and shifted and screws placed into the bone, that involves a little longer recovery period. Usually it's 2 weeks without walking on it, but then weight bearing in a protective surgery boot. At the 4-week point up to 6 weeks, we'll start wearing a regular shoe. It might take 2 to 3 months before a dress shoe could be worn. A patient should seek a podiatrist when they first start having symptoms, pain, or notice an enlargement on their great toe. At that point, initial x-rays will be taken and we will start conservative treatments. We will also take initial x-rays just to see how bad the bunion is as far as the joint moving away from the normal position. Once a patient has fully recovered from the bunion surgery, they're usually very happy with the procedure. They can return to their regular shoe gear and all activities without a problem.